All right, so to start again, thank you, Hannah, again for asking me to join you on this topic. As I was saying, it's a topic that's really important to me for a lot of reasons. In the 11 years of practice, I've worked alongside midwives pretty much the whole time, including having midwives in the clinic that I own in the Lower Mainland. And so it's definitely something that I've focused a lot of my practice on. I'm also currently 32 weeks pregnant with my second, so obviously have a little bit more of a personal vested interest in nutrition and pregnancy, but definitely a big part of my practice as well. So I am sorry, just to introduce myself again, Dr. Pamela Smith. I'm a naturopathic physician in British Columbia, and I have offices in the Lower Mainland and also in Kelowna in the interior. So today, what I wanted to sort of cover were the important macro and micronutrients, and we'll go over what those all look like in each trimester as well. Foods that are best to sort of avoid and limit, and I put like quotations around that because, um, yeah, there's a lot of foods that we have sort of victimized, and maybe they're not as harmful as we once thought. Common symptoms of pregnancy, and maybe there's a few options for food choices in those cases. And then I did want to add a little bit of a blurb on supplementation. Obviously, focus today is on diet, but there were quite a few questions around supplements, but also the importance of picking out the right ones. So a macronutrient is what gives your body energy. So that's the bigger food groups. So carbohydrates, proteins, and fats. And our protein needs do increase in pregnancy. They obviously steadily go up each trimester, but it takes a lot of energy to grow a human, obviously, and just the even what our bodies change go through as well. And so that need does go up quite a bit. The obvious sources like animal protein, seafood, eggs, but there are options too for vegetarian diets. It just means we have to focus a little bit more on quantity sometimes, quality, that kind of a thing. As a sort of background with proteins, the building block of a protein is called an amino acid. And there's about 20 standard ones, and some of them are essential, meaning that we need to get them from our diet in order to maintain health in life. There's one that's kind of an interesting amino acid called glycine, and it actually becomes an essential amino acid, or sorry, it's not essential when we're not pregnant, but in pregnancy, it actually switches to become an essential amino acid. In pregnancy because of the demands that we needed. So it's kind of an interesting thing that also happens in protein. Our metabolism switches, and that's one example. We usually can get enough glycine from animal protein, dairy, those types of, and that says diary. I just realized. I apologize for the spelling error there. But anyways, the we typically can get enough without needing to supplement, but that's just one thing that sometimes I will look at someone's diet, especially if they are a vegetarian diet. Carbohydrates, you can see there's a huge range there, and it really depends on who you talk to, maybe what study you're looking at that day. It's really a variety. And so historically, we were sort of told that 65% of all the calories should come from carbohydrates. That wasn't really backed in, I guess, a scientific way. Now we see it's probably a little bit less. So again, it's going to depend on your activity level, body composition, there's a lot of different factors that come to it. And we can, obviously, in the first trimester, we're going to maybe be leaning into carbohydrates a little bit more, especially if you're feeling quite nauseous and that type of thing. And maybe into the later trimesters, looking at a lower glycemic load, especially if blood sugars may be an issue. But still a really important component of our energy needs in pregnancy. And then the body's need for fat actually goes up quite a bit as well, especially because those fat soluble nutrients that we need are exponentially increased. And so the fat component of our diet from healthy sources, so that could be fatty fishes, grass-fed meats, and then of course all the nuts and seeds and things like that that we are commonly known for having a higher fat content. We also know how important healthy fat is in fertility health as well. So they have found that infertility or even risks of miscarriage with a lower fat diet. So something that we want to look at as 30 to 40% of all the calories that we are getting. There are different types of healthy fats as well. So omega-3 is kind of like an umbrella term for the anti-inflammatory fats that we can get in our diet. The other component is an omega-6. There's a couple things that are anti-inflammatory within that umbrella, but a lot are inflammatory. So we want to have a balance of 1 to 1 omega-3 to omega-6, even maybe a 1 to 3 ratio between omega-3 and omega-6. But some diets can be as high as 1 to 30, with the 30 being the inflammatory or pro-inflammatory omega-6, sorry. And so we can see that a diet high in those inflammatory omega-6s have actually been linked to developmental delays in baby, but also depression and anxiety later in life, which is kind of interesting. When women had a higher consumption of omega-6 pro-inflammatory fats, these are included in things like processed seed oils. So that could be soy oil or cottonseed or corn oil, canola oil, those types of oils, which we actually see quite a bit in our diet, especially when it's more packaged or if there's, well, trans fats is a whole different thing, but the kind of more prepackaged foods or yeah, those are things to kind of look out for the most. But when we're looking at the omega-3s in our diet, we want to, it's sometimes hard to get, especially because a good source of being fatty fish, as we'll discover, like that can be a hard topic for a lot of people. We're kind of blanket statement to sort of avoid seafood and things like that. So we'll go over the myth of that in a minute. But 60% of baby's brain is actually built from DHA stores. So that's one of the components of an omega-3 essential fatty acid. And we're building this from scratch, right? So we're actually stealing from mom a little bit with that. And so pregnancy brain is a real thing. And so we want to make sure that we're getting a good amount of that DHA. And I'll go over kind of what that looks like in subsequent slides. So I apologize for all the words on this one, but I just wanted to put a few of the key micronutrients. So micronutrients are sort of those vitamins and minerals that your body needs to function. We're getting a lot more information about recommended daily allowances, but unfortunately they're not those values aren't really based on science, or they're a little bit outdated. So we kind of have to sort of use other ideals. Choline is getting a lot of attention, which is great. We know that it's so important for baby's brain, placental development, and memory and cognition, not just for baby, but for mom as well. It's pretty easy to get in a diet that's animal protein, like animal based. Vegetarian diets are a little bit harder to get. The ideal amount is sort of again tricky. There's the minimum kind of being about 450 milligrams per day, whereas maybe ideals are even like double that. But one egg, for example, has 150 milligrams in it. So if you are able to consume animal protein, we are seeing you probably could get a lot of that from your diet. B vitamins are obviously really important. They're really important for methylation process, which is what is needed for cellular growth and development. Obviously, folate is what we associate the most with neurotube defects and development as well. And so, with the folate specifically, you want to aim from anywhere from 1 to 5 milligrams per day. Deficiencies in the B vitamins generally can lead to risk of miscarriage, obviously neurotube defects, and also preterm labor. So definitely one that potentially we can get from diet, but I often am recommending a prenatal vitamin to at least supplement some of those needs, and we'll go over that again at the end. Of course, iron is super important for a lot of reasons. It's estimated that only 20% of women have adequate iron stores to maintain a pregnancy. So this is why we want to, why we screen in, at least in Canada for in the first trimester, which is a good sort of idea of like where you're maybe starting the pregnancy out. The the demands as you travel through your pregnancy obviously increase, plus due to blood volume and what's called hemodilution. It tends to sort of get less and less as the trimesters go on. I find that if to maintain a pregnancy, we need a ferritin, which is your iron stores of at least 70. And I rarely see women start their pregnancy out with that. Now, the dose that you may need if we're looking at supplementation, it really is based on that prenatal blood work to get an idea. If someone has good stores, say, you still need around 27 milligrams a day in pregnancy to match what baby and the mom needs to maintain that. So it's one of the things that we want to make sure we're assessing and getting on top of. Inadequate iron obviously increases the risk for a lot of different things. Preeclampsia is part of that, thyroid issues, preterm birth, and actually there may be some associations with chronically low levels and impairments to baby's development, shunted growth, and actually can put your baby at risk for diabetes and hypertension later in life, which is kind of interesting. That's what's kind of happening to baby, but let's think about mom. Like low iron, of course, we know obviously fatigue, heart palpitations, muscle cramps, shortness of breath, all the things that moms can deal with when we think about iron. And we'll go over what that might look like for supplementation because obviously that can be a tricky thing to take and get enough in the diet. So we want to look at maybe options for moms who don't tolerate oral iron. So we talked a little bit about DHEA, obviously, in the previous slide. In terms of dosing, again, the research is sort of conflicted in terms of like what's ideal, what's the most. Typically, the thought was around 250 to 300 milligrams, but they did a study a few years ago looking at moms who took about 650, especially in their late, like throughout pregnancy, sorry, from first trimester onwards, and they actually found that cortical development in baby and IQ scores by age 5 are a little bit higher in the baby kids, I guess, whose moms supplemented at least 650. Now, a lot of focus is on DHA because of that brain development, but we actually do need the EPA as well. So there's a bit of a balance. And EPA is especially important for delivery. We think that it has some relation with that natural oxytocin production to initiate labor. So we don't want to just focus on DHEA. And when we're getting it from food sources, you're getting that balance. But a lot of the prenatal supplements do focus just on the DHEA, so something to think about. With vitamin D, it's not, at least in BC, or British Columbia, it's not part of our routine screening at all. In fact, you have to pay for it out of pocket, but it is something that I will sometimes suggest that moms look into, even before, maybe during their fertility journey, to have a look at that before they get pregnant. Especially for my lower mainland patients where we're a little bit more covered in clouds throughout the year, but that dose we can dose the mom appropriately from that. The RDA is super, super low. So the recommended daily allowance is like, I think 600 or 800 IU, which is not actually enough. They have looked at that from different in different studies, and they actually did a study looking at moms who were taking 400 IU, 2000 and 4000, and they found that the 4000 group actually maintained and elevated blood serum levels of vitamin D more efficiently without toxicity. Now, I'm going to put a caveat there that there is a risk of toxicity with vitamin D. That's why I do like testing, so we can be a little bit more specific with our dosing. But I do think that the RDA is way too low for that, and it's such an important nutrient. When moms are deficient, they have been shown to increase anxiety and depression in mom, but also in baby later in life. Plus, we know that it's important for bone development and bone health, and actually blood sugar management as well. And then we have seen recurrent miscarriage not necessarily be causational of that, but possibly a correlational with low vitamin D levels. And then calcium, magnesium, obviously super important for muscle and bone development, prevention of preeclampsia. Um, Magnesium deficiency is one that I take a little bit more seriously. We don't get as much magnesium in our diet anymore, and we use up a ton of it, especially when progesterone and cortisol levels and things like that start to go up. The increased demand in Magnesium also goes up. It's also important for balancing blood sugars, and maybe a deficiency may be associated with nausea in pregnancy. So, kind of tied in there with that. Calcium, I don't always get women to supplement with. That might be an unpopular position on that, but we can get a lot in our diet. As Hannah mentioned, with all the Greek yogurts and hopefully full fat yogurts that a lot of women do crave in pregnancy. One cup is like almost 300 milligrams. And the RDA for pregnancy is around 1,200 to 1,500. So we can get enough in our diet. There are some instances where I'll maybe get women to focus on it more from a supplementary component when they're having like muscle cramps, leg cramps, and like heartburn. It can actually be a help there. But typically, I'm trying to do things through diet with respect to the calcium. And then iodine doesn't get as much attention as maybe as it deserves. Iodine is a really important micronutrient for thyroid support. And our thyroid demands, especially in the first trimester, go up exponentially. Baby needs RT4, which is a thyroid hormone, because they're not producing their own, especially in that first trimester. And we know that deficiency in iodine can sort of influence that thyroid, of course, our metabolic health and even brain development. The RDA for that is around 1,500 micrograms. So the nice thing is a lot of that is in some prenatals, maybe not that dose, but a little bit, we're getting some in dairy. So maybe that's a great source for those that can tolerate dairy. And then again, we're getting it a little bit more in the cold water fish and seaweeds if that's available. So, what foods are not considered safe? Again, putting those in brackets or parentheses because any food could be unsafe potentially. It's really how it's handled is the key. So a lot of the things that we are told not to eat aren't really based on scientific evidence, just more the theoretical risk of an infection. So obviously we're concerned about infection in pregnancy. Obviously the demand of the immune system is already high, plus women are a little bit more susceptible to infections. And food poisoning can literally cause some serious complications, including, potentially miscarriage and things like that. So obviously we do want to take this consideration. But up to 46% of all food poisonings are actually from fruit and vegetables, and they're not as maybe noticed of, or at least told about. So I listed some examples here of like listeria outbreaks in different foods that maybe we would be eating. Sometimes potlucks are a bit of a tricky one too. So just making sure that you know how your food is being handled and obviously safe practices around like cutting boards and not cutting raw meat with like vegetables and different things like that. They have looked at the odds of, for example, eggs containing salmonella. So that can be anywhere from 1 in 12,000 to 30,000 eggs. And these odds actually go significantly lower if you're getting free range or organic farmed eggs. It seems to be a less chance of the salmonella. Deli meats, obviously, I have some concerns with like other components of that in terms of processing and nitrates and things like that. But the risk of listeria, for example, in a deli meat is like 1 in 83,000 is what they've looked at of servings, sorry, of deli meat. So again, maybe the risk is a little bit lower, but has it been sitting out? Is it from a deli that's been, food safe approved and all the things? So things like that to just sort of look out for. And then fish and mercury. So some countries, especially for example Japan, the benefit kind of outweighing that risk. We talked about how important those omegas are for our brains, but also baby as well. So it seems that the low bioaccumulators, I mean, it's typically smaller or fish like herring and sardines and cod and things like that, and then wild salmon specifically, seem to be okay in terms of that toxic output. Now, again, it's really hard to know. Our poor oceans are not in great shape, so that's a bit of a trickier one. But things that are really big, like swordfish and that, are ones that you might want to avoid. Tuna is a tricky one as well because it is quite a big fish. It does have the ability to bioaccumulate. What's deemed safe is like 6 ounces a week. I would actually probably say maybe less than that would be my recommendation, maybe like once a week or whatnot. But that is definitely one that can bioaccumulate as well. And whether or not to do raw fish, sushi, that type of thing. So if it's, again, handled correctly, it most likely is okay. If you go to your favorite sushi place or you've never had an issue before, the chances are probably fairly low. One incidence of raw, I'd say, was maybe not raw, like raw shellfish. That might be one to definitely avoid during pregnancy. Um, but we know the importance of the omegas and the benefit. And like I said, in countries like Japan, women are definitely encouraged to eat like raw fish and seafoods and things like that. So, and we don't necessarily see issues with infections in that population. I like to bring up caffeine. I'm not someone that takes away coffee from from a tired mom. There was one study years and years ago where they kind of had this magic number of like 200 milligrams is what they kind of found as sort of a safety upper limit. Since then, they haven't necessarily been able to repeat that. But again, it's there's a lot of things that are tricky to study when pregnant. So we still kind of use that as a threshold, especially because babies' levels are going to be similar to moms. And so, we know that, for example, growth delays and things like that are potential theoretical risk. But I think it's probably okay to go up to about a 16-ounce coffee. That would kind of max out at the 200. But just watch where you're getting it from all sources. So dark chocolate and teas and different things like that can actually that adds to the caffeine intake in a day. And then I wanted to make a note about artificial sweeteners. We're seeing it a lot more in things like even like protein powders or like energy drinks and things that obviously are I'm thinking of like the ideal protein. I see that a lot coming up from for people to get that quick protein, but sadly they're using those artificial sweeteners. And we found that not just in pregnancy, but those who consume more artificial sweeteners are actually likely to have more issues with their blood sugars. Their cravings for sugar go up. So it's not this like great alternative for people that we once maybe thought or originally thought in terms of blood sugar regulation because it does increase those cravings for it. And so I have a stat here that women who consumed artificial sweeteners, on average, it was like 1 to 2 a day, so quite a high amount, to be honest. Were 2 times more likely to have an o overweight child by age 7 compared to those who didn't have any at all. And that's actually even if mom didn't gain or have a gestational diabetes or issues with body composition at all in their pregnancy. So it's kind of interesting that they seem to have affected baby that way. We know that they can disrupt the thyroid, though, so that could be part of that. And we also know that they can disrupt our gut microbiome, which is a huge topic within itself. They do increase the cravings for sugars and sugar dependence. So in the first trimester, technically the caloric need is the same that it would be in pre-pregnancy. Now we know with the bloating and the nausea and just feeling kind of unwell generally in the first trimester, we we tend to kind of eat a little bit more because of that, or sometimes less. It sort of depends on the person and what how they're feeling. So a lot of these suggestions for like you know, making sure you're getting good protein and vegetables and all the things kind of go out the window when you're feeling unwell. And that is actually okay. For women with severe nausea, I've literally recommended poutine because I was like, I just need you to get calories to stop losing weight. So, it's one of those things that we are understanding about. And in an ideal world, great, we're going to focus on all those healthy foods, but sometimes that's not the case in the first trimester, and that's okay. The key nutrients obviously are going to be all the things we've already discussed in terms of the B vitamins, choline, DHA, all really important. Calcium-rich foods are a good time to add those in too, and sometimes that actually can feel good and settle the stomach. So dairy products and things like that. This is where we're also getting our prenatal screening done. So here in BC, a baseline hematology, which is the CBC, ferritin being our iron stores, and thyroid from the TSH. I often will add the vitamin D, like I mentioned, and sometimes I'll also request a hemoglobin A1C for the reason that if we're worried about gestational diabetes, this started before pregnancy. And so if we can get ahead of it or at least have an idea of where maybe someone might be landing before we get into the second trimester and actually testing for that, then I think there's some benefit and maybe we can even prevent the need for things like insulin later on. Now, A1C isn't the like gold standard in pregnancy for diagnosing gestational diabetes. However, it's a good screening tool in the first trimester to kind of see where someone might be landing. And of course, as we've talked about, protein is a big one for me, and then staying hydrated. I have a little star there with herbal teas because sometimes water just doesn't feel good in the first trimester, but it's really hard to know what teas are safe. And again, that's something that I could probably discuss at nauseam but around it, but just a quick sort of list, things like chamomile, echinacea, ginger, ginseng, peppermint or spearmint, raspberry, turmeric. Those are all things that are considered category A or safe in the first trimester and pregnancy generally. Second trimester nutrients, typically when women start to feel better, hopefully within a bit more themselves in this trimester, the caloric need does go up a little bit in this trimester, so kind of like one snack extra. Tepid. Again, we're not quantifying that necessarily for women, but it does increase at that time. If you do have an appetite at this point, then really focusing on those balanced meals. So half your plate being veggies. And this vegetable summary, I actually don't just give in pregnancy, but it's a good one for life too, in terms of something colorful, something green and leafy. And then the brassica family is like kale, cabbage, broccoli, cauliflower, kohlrabi, like those Brussels sprouts, that family, really, really good for like liver processing of all the hormones that our body's going through. So if you can tolerate, sorry, vegetables during that time, this is a great time to do that and really focus on those nutrients when you're starting to feel a little bit better. This is also when we see repeats of blood work and when they're going to be doing the glucose screening. In BC, it's around 24 to 28 weeks. And here we'll probably see a pretty big drop in our ferritin, possibly in our hemoglobin levels as well because of hemodilution. And so this is when we're really wanting to make sure that we're focusing on iron because we're not as good at creating stores in the third trimester, especially later in the third trimester of iron. So our body really relies on that first and second trimester to get the levels there. So again, this is when we're treating that at least here in BC. And then third trimester, obviously, it's very apparent that baby's growing fast. Protein needs to go up, and of course that iron component. So yeah, daily caloric intake does go up. The need goes up, sorry. And this the key nutrients kind of similar, obviously, throughout. We're seeing a little bit more glycine because of that red blood cell formation is needed, and then good bacteria. So there was a study done quite a few years ago now, but they actually looked at moms who took probiotics in their third trimesters, around 36 weeks, and if they breastfed through breastfeeding. They followed the kids later on and found that it was significant decrease in atopic dermatitis, so eczema, things like that, and possibly a decrease in certain lung issues as well for those kids. So it's kind of interesting that it may those good bacteria during that gestational period may influence our allergic sensitization even up to age 5. So that's a good time to be on possibly a probiotic. Now we can get a really good amount in fermented foods. However, a lot of those are a bit more transient. It just means you have to eat them on a more regular basis. So some in the supplements, I'll go over some ideas of probiotics if that's the route you want to go. But it's definitely a time where we'd want to consider it as well. And then obviously we'll go over some of the challenges, but we see a little bit more in the third trimester. It's hard to tie shoes without getting a mouthful of acid usually at this point. Your body's ability to eat large meals goes way down. Again, because I was joking earlier that your stomach's somewhere jammed up inside your rib cage. Constipation and obviously body discomfort can also make eating a little bit challenging. So smaller meals, especially when you feel too full too fast. And then the fourth trimester, so I could literally spend an entire 30 minutes on nutrition for this time of life. This, especially with breastfeeding, if that's a possibility or what something you choose to do, the additional 500 calories a day. So that's almost like a full meal a day is needed. And it's also a harder time to get that support if you don't have extra hands to help you out with it. Protein aiming about 100 grams a day, which is quite a bit more than what we saw in pregnancy for most women, but we're really important for that tissue healing, blood sugar balance, and actually just producing milk as well. Hydration, of course, is super important, and sometimes we want to have electrolytes in our diet, so that could be bone broth teas. Bone broths are also really quite healing as well. There's lots of collagen and a ton of glycine actually in there, and then wanting to focus on warm foods, stews, etc. I put this. This is a book that it really does sort of focus on that fourth trimester nutrition and from different cultural perspectives. So, if you're not aware of this book, it can be quite a good one because it does give some meal suggestions, some science around why, and I like the additional of like how other cultures treat the fourth trimester because I find in Canada, but probably North America, we're not giving it the time that it sometimes needs. So common symptoms in pregnancy, obviously nausea can happen throughout, and it's estimated about 80% of women do feel nauseous at some point in their pregnancy. It's interesting, there's a lot of focus on ginger. Ginger is quite warming and it helps with like digestive movement. It also improves serotonin levels in the gut, so it can be quite helpful for those reasons. But peppermint might be one that's a little less known. Peppermint kind of has like a numbing effect on the digestive system, which can be helpful, and it also helps with like reducing spasms in the gut health is sorry, the gut essentially, but it kind of depends on what type of nausea you have. So I sometimes will get women to like try the ginger because that's sort of the tried and true and lots of research behind it. But if it doesn't really help, maybe a peppermint would be a better option. Obviously, there's capsules too if we don't want to fill up on the liquids or that's hard to do, or even candies can be helpful. And sometimes in the office I'll offer B6 injections. I find those can be really quite helpful as well. Constipation, probably more so. I mean, that can happen throughout all trimesters, but probably a lot more frequent in the third trimester. Obviously, fiber is really important. The even prunes, stewed prunes can be quite helpful. Sometimes I'll reach for the fermented foods here, probiotics, and the magnesium citrate specifically can be a really good nutrient for constipation. Bloating we'll probably see throughout as well, but a lot in the first trimester. So that's an appropriate time to look at fermented foods as well. But sometimes it's just because of the hormones, so hard to get ahead of that one. Heartburn, again, probably seeing it a little bit more in the third trimester, just because again everything's being pushed up. But sometimes it can be quite severe for some moms. And this is like I said earlier, where maybe I might recommend like a liquid calcium magnesium. That calcium's kind of like a Tums effect, where it has that calming on the acid. There's also a nutrient called DGL. It's deglycinated licorice, and that one's category A or B, depending on what you're looking at, meaning that safe in pregnancy, and that can also be quite helpful for heartburn. Low energy is a tricky one because obviously there's a lot of reasons for that. How's your iron levels? Do you have other little humans that you're trying to keep alive? So there's a lot of reasons for that, and plus just the energy needed to make a human. So the iron obviously is a big one for food sources or possibly supplementation. There are certain herbs that I'll recommend, and I'm not going to list them out here because they are considered category B, meaning documented, safe, but best to have a practitioner looking out for you. So there are certain herbs that I will use for energy, if especially if moms are trying to do it all. But the big one is take the time to rest. If you are a napper, please nap. Just try and get the rest you can. I just appreciate that that's not always available, timing wise. And then glucose issues or gestational diabetes mellitus. Obviously, this is a time where we're going to look at carbohydrate intake more seriously maybe, or the emphasis on that protein and fat where we can. Movement post-meal actually does improve glycemic control. So that's a really good one to, like, obviously with Hannah's yoga or going for walks after, different ways to improve glucose metabolism just through that. There's a lot that I talk about, and again, probably could spend 30 minutes just talking on glucose. I know that was one of the questions that someone had, but giving specific examples is kind of tricky. So these are sort of emphasis that I go over, plus that can be a whole conversation on its own. There was one more topic that someone had asked about platelet production. Obviously, platelets are part of our total blood count that we get monitored throughout pregnancy, and it's really important. They're really important for obviously preventing excessive bleeding, especially during delivery. And so there are food ways of improving that. So sometimes I'll recommend spirulina, chlorella, and I've seen a combination of those two nutrients with B12 injections improve platelets within 2 weeks. So I've had working with midwives, having women come to me being like, I want a home birth. Their platelets are below 100, 120. So that doesn't qualify for them. Within 2 weeks of administering the B12 and the chlorella and the spirulina, we're able to get them into a safe zone to do a home birth. So definitely something that's responds pretty quickly to treatment. A lot more women are being put on low dose aspirin. It's commonly given in pregnancy to help prevent miscarriage and preeclampsia and different things like that. And that also affects platelet levels. So something that I'll be screening for too if we see low platelets. And then supplementation. So again, I always kind of joke in my practice that you need a PhD to pick out supplements these days. So I usually like to give these sort of like general statements of what to look for. And one thing to note is that what's in the bracket is in the pill. So when you flip it over and it's like folate, but folic acid in the pill, we're kind of confused, like what's in here. So we want to look for activated form of the B vitamins. And things to look out for is B12 will start with an M. B9 will say folate, or I kind of joke it looks like a swear word because now you won't forget. But that's that methylfolate, which is, as you can see, we'll go into in a minute here, an important form of folate. And then B6 will have a 5 in it. So those are things to kind of pick out in the label in the bracket that you're actually getting the Bs in their activated form. To draw attention to the chart here, this is why. So we absorb methylfolate and we use methylfolate for all the things that we talked about in that one of those first slides and the importance of B vitamins. When we're taking synthetic folic acid, it's got to go through multiple steps to get to that, what the body actually uses. And I do a lot with what's called nutrigenomics. So looking at how someone's genes may influence their body's ability to absorb nutrients and utilize nutrients. And it's very, very rare that I don't see at least one SNP or issue with this process from folic acid to folate. So I typically just say blanket statement for everyone, pregnant or not, let's just get you on a methylated product. There's a little bit of a caveat there with too much methylation, but it's kind of more rare and definitely not, I don't see it in pregnancy as commonly. The other thing to look for in a prenatal is that there are no mineral oxides, or very few. We don't absorb oxides as well. Most of that just sort of stays in the gut. So we want to look at other forms, whether that be a glycinate form or fumarate form or chelates or citrates, things like that. And we don't need pink and purple and blue. So no dyes. No, they're usually aluminum based, which we know we're growing a nervous system. So definitely don't want to have that extra burden on the body. It's just not necessary. I'm going to say, if you go look at your cupboard and your prenatal is folic acid and it's pink and yellow and blue and full of oxides, there are millions and millions of babies who are healthy and born with these multivitamins, and it's fine. Most of the studies for neurotube defect prevention was on the synthetic folic acid, so we know there's benefit there. It's just when we have this information, I like to share it, and then we can utilize that. So if you do have that at home, maybe you can put that aside and grab a new one, and later on after pregnancy, go back to it if you want to use it up. Omega-3s. So I'm not going to give exact like companies or anything like that because there's just so many out there that do a good job, but ideally small batch. So companies like that you can actually look up their like lot number and see like they've looked at the different issues that may be up with it, or what they've screened that lot for. Ideally, they're not shipping in big batches because there is more risk of oxidization when the company does that. And then if it is a liquid form, then a dark glass bottle would be good to again prevent that oxidization. Um, but that would be one thing to kind of look for. Vitamin D, I just sort of put D3 there. So there's D2 is what we're seeing mostly fortified in different like foods like dairy and things like that. It's D3 that has the hormonal properties to it of all the benefits. So that's one to look out for. And then forms of iron. So this is tricky, especially because iron can be hard to digest and can sit in the gut. That's why I kind of like the liposomal forms. So that means that it's kind of encroached in this like beneficial fat that we just absorb. We don't need this mechanism to absorb it. But glycinates and fumarates are good. And I like it too when there's cofactors. So that might be, again, glycine, copper, um, B12, B9, those types of things as well. And then I put a little question mark, iron IV. That is something that we do a lot in our practice just because it can take a lot of effort with oral to supplementation to get your iron levels up. Sometimes it's not tolerated. So sometimes the IV just sort of bypasses all of that and is safe in pregnancy. And then probiotics, like we mentioned earlier, there was that Swansea study with the atopic dermatitis. And then they also found that, well, so we know that the lactobacillus species are really important. So if you are choosing an oral probiotic, I like full spectrum, meaning there's a few different strains, but especially this Lactobacillus rhamnosus, we know that's one of the major strains of the vaginal canal. And so if a vaginal delivery is appropriate or occurs, then that's where baby's getting a lot of their microbiome from. And so, if you do find a full spectrum probiotic, then look for that species specifically. We only need about 1 to 2 billion of it, so it's not like we need a huge amount of that one specific, but that's one I like to kind of recommend. And I sometimes will recommend around 30 billion, especially in those last 6 weeks of pregnancy and into breastfeeding if you're choosing to do that, just because that was what was studied. But you can take probiotics throughout pregnancy at any point if you want for supplementation that way. And that's me getting my iron IV a couple weeks ago. So like I mentioned, I am also 32 weeks pregnant, and I had my iron was over 70 in my first trimester, and it dropped significantly by my third. So I decided just to go ahead with the iron IV because that day I started feeling miles better. So it's definitely something we do a lot of in our practice. And then just to kind of wrap up before we get into questions, something I can also will put up and maybe we can email out is I do have a few like first, second trimester, third, fourth trimester meal plans. If people are interested in those, they're just really quick options. But yeah, there's not really a one size fits all. So if it gives you some ideas of meal plans, which is sometimes the hardest thing, then yeah, can let us know.
Well, I'm going to
That yeah.
stop the presentation now.